Good afternoon, everyone. I'm Dr. Amelia Wright, and I've been practicing medicine for over 25 years now. Today, I want to talk to you about something that most men don't know, something that's rarely discussed openly, yet it's absolutely crucial for maintaining a fulfilling relationship later in life. This is about understanding what truly brings joy to a woman's heart and body, particularly as we navigate our later years together. Now, I know this might feel a bit awkward at first, but trust me, after more than 2 decades of counseling couples, I've heard it all. There's nothing to be embarrassed about. In fact, the couples who thrive in their 70s, 80s, and beyond are the ones who've learnt to talk openly about intimacy. So, let's have an honest conversation, shall we? Here's something that might surprise you. According to research from Oxford University, couples who maintain physical intimacy well into their later years report significantly higher levels of overall life satisfaction. We're not just talking about sex here. We're talking about touch, affection, and genuine connection. Yet so many men I've spoken to over the years have told me they simply don't know what their partners truly want or need. You see, as we age, everything changes. Our bodies change, our needs change, and yes, our intimate lives change too. But here's the thing. Change doesn't mean decline, it means adaptation. And those who adapt well often discover a depth of intimacy they never experienced in their younger years. Let me start with something fundamental that I've observed time and time again in my practice. Women, particularly as they age, crave emotional connection, even more than physical touch. Now, that's not to say the physical aspect isn't important. It absolutely is. But without that emotional foundation, the physical side often falls flat. What does this mean practically? It means that before you even think about the bedroom, you need to think about the everyday moments. How do you speak to your partner? When was the last time you truly listened to her? Not just waiting for your turn to talk, but really listened. When did you last tell her something you appreciate about her, something specific and genuine? I remember one chap, John, who came to see me a few years back. He was 72, and he was frustrated because, as he put it, things just weren't working anymore. When I asked him about his relationship beyond the bedroom, he couldn't tell me the last time he'd complimented his wife or asked about her day with genuine interest. We worked on that first, and you know what? Within a few months, he came back with a completely different story. The physical side had improved, yes, but more importantly, they were happy again. Now, let's talk about something more specific. The power of touch that doesn't lead anywhere. This is something most men struggle with. You've been conditioned to think that every touch, every caress, must lead to something more. But here's what women have been trying to tell us for decades. Sometimes touch is just about touch. It's about connection, reassurance, and affection. Try this. Tonight, when you're sitting together watching the telly, reach over and hold her hand. Don't say anything, don't expect anything. Just hold her hand. Or, when you're in the kitchen together, put your hand on the small of her back as you walk past. These small gestures create an atmosphere of constant affection that makes a woman feel valued and desired, not just when you want something, but all the time. According to research from the World Health Organization, regular physical affection, and I'm talking about hugs, hand-holding, gentle touches, can actually lower blood pressure, reduce stress hormones, and improve overall cardiovascular health. So you're not just making your partner happy, you're both getting healthier. Now, I want to address something that I know concerns many of you: the physical changes that come with age. Perhaps things don't work quite as they used to. Perhaps you're taking medication that affects your libido. Perhaps you're simply not as flexible as you once were. All of this is perfectly normal, and none of it means your intimate life is over. What it does mean is that you need to be creative, and more importantly, you need to communicate. The biggest mistake I see couples make is assuming. You assume she doesn't want intimacy anymore because you're both older. She assumes you're not interested because you haven't initiated anything. Meanwhile, you're both lying there, wanting the same thing, but too afraid to say anything. Here's something practical. Many older couples find that mornings work better than evenings. You're both more rested, hormone levels are naturally higher in the morning, and you're not exhausted from the day. There's no rule that says intimacy must happen at night. Find what works for you both. And speaking of what works, let's talk about patience and attention to detail. This is where I see the biggest gap between what men think women want and what they actually want. In my experience, women often tell me their partners rush through foreplay or skip it entirely. Gentlemen, this is crucial. As we age, women need even more time and attention than they did when they were younger. The physiological reason is simple. After menopause, vaginal dryness becomes more common, natural lubrication takes longer, and sensitivity can change. This isn't a problem, it's just a fact. What it means is that you need to slow down, be more attentive. And yes, don't be shy about using lubricants. There's nothing unnatural about it, it's just common sense. Now, here's something specific that many men don't realize. The clitoris has over 8,000 nerve endings, more than any other part of the human body. Yet, in my conversations with women over the years, I'd say at least 70% have told me their partners either ignore it entirely or don't pay it proper attention. This is a missed opportunity, gentlemen. When it comes to oral stimulation, which several couples have mentioned to me over the years as being particularly satisfying, the key is patience and reading your partner's responses. Every woman is different. What works for one might not work for another. Pay attention to her breathing, her movements, her sounds. If she's tensing up or pulling away, that's not good. Try something different. If she's relaxing into it or moving closer, you're on the right track. Start slowly and gently. Use your whole tongue, not just the tip. Vary the pressure and rhythm. And for goodness sake, when you find something that's clearly working, don't suddenly change what you're doing. I can't tell you how many women have told me about the frustration of their partner finding the right rhythm and then inexplicably stopping or changing technique just when things were building. One gentleman I counseled, he was 80 years old, came back to see me absolutely chuffed. He said, "Doc, my wife told me she felt like she was floating in space." That's the kind of response you're looking for. Complete relaxation, complete trust, complete pleasure. But here's the thing. This level of intimacy requires trust and comfort. You can't achieve it if your partner is self-conscious or worried about how she looks or smells or any of the 100 things women worry about. This is where your attitude makes all the difference. Make it clear through your words and actions that you find her attractive, that you desire her, that you're enjoying this. Enthusiasm, gentlemen, is incredibly attractive. And whilst we're on the subject of enthusiasm, let's talk about your own physical well-being. If you want to maintain an active, intimate life, you need to take care of yourself. This means regular exercise. And I'm not talking about running marathons. A good walk every day does wonders. It means eating reasonably well, not smoking, limiting alcohol, and managing stress. Many of the erectile difficulties men experience later in life are related to cardiovascular health. The blood vessels involved in achieving and maintaining an erection are quite small, and they're often the first to be affected by things like high blood pressure, high cholesterol, or diabetes. So when I tell you to take care of your health, I'm not just being a nagging doctor. I'm telling you how to maintain your quality of life in every sense. There's also the matter of medication. If you're taking blood pressure medication, antidepressants, or various other common prescriptions, they can affect sexual function. Don't just accept this as inevitable. Talk to your GP. Often there are alternatives or adjustments that can be made. And if you're struggling with erectile dysfunction, there are treatments available. Don't suffer in silence out of embarrassment. We doctors have seen and heard everything. There's nothing to be ashamed of. Now, let me share something that might seem counterintuitive. Some of the happiest couples I know in their 70s and 80s aren't necessarily having penetrative sex regularly, but they're incredibly intimate. They've discovered that intimacy isn't just about intercourse. It's about kissing, touching, oral pleasuring, mutual pleasuring with hands, lying naked together, bathing together, all sorts of activities that create connection and pleasure. In fact, many women tell me that they appreciate this broader definition of intimacy. The pressure to perform or to achieve orgasm through intercourse alone, which, by the way, most women don't achieve easily anyway, regardless of age, is removed. Instead, you're both free to explore what feels good, without a specific goal in mind. This brings me to something rather important about female pleasure that many men don't fully understand. Most women don't climax from penetration alone. They need clitoral stimulation. This isn't a failure on anyone's part, it's just anatomy. The clitoris is where the nerve endings are concentrated. So whether you're using your fingers, your mouth, or incorporating this kind of stimulation during intercourse, it's essential. I remember one couple, both in their late 70s, who came to see me because the husband was devastated that he couldn't maintain an erection like he used to. We had a long conversation about alternatives, and I suggested they experiment with manual and oral stimulation. They came back a month later, both looking rather pleased with themselves. She told me, quite directly, that she'd had more orgasms in the past month than she'd had in the previous year. He'd been so focused on penetrative sex that he'd overlooked all the other possibilities. This is what I mean when I say that age can actually improve your intimate life if you approach it with the right attitude. You're forced to slow down, to communicate, to be more creative. And the result can be more satisfying for both of you than what you had in your younger years. Let's talk practically about creating the right environment. This matters more than you might think. Make sure the bedroom is warm. Older bodies feel the cold more. Make sure there's adequate lighting so you can see each other, but perhaps softer lighting, that's more flattering. Clean sheets, a comfortable bed, minimal distractions. These things set the stage. And timing matters too. If you're both exhausted at the end of the day, plan for morning intimacy instead. Or weekend afternoons. There's no rule that says passion must wait until bedtime. In fact, some of the best encounters happen spontaneously when you're both relaxed and not under pressure. Here's another practical tip that couples have shared with me over the years. Take a bath or shower together first. It's intimate, it relaxes you both, it gets you comfortable with each other's bodies, and it ensures you're both feeling fresh and confident. Plus, warm water increases blood flow, which is helpful for arousal. Now, I want to address something that I know worries many men, the concern that you're not as good as you used to be, that you're not satisfying your partner. First of all, stop comparing yourself to your younger self. You're not meant to be the same. You're meant to be better in different ways. You have more patience now, more understanding, more appreciation for your partner. Use those strengths. Secondly, the only way to know if your partner is satisfied is to ask. Not in a nervous, insecure way, but in a genuine, caring way. What did you enjoy? What would you like more of? Is there anything you'd like to try? Make it a conversation, not an interrogation. Some couples find it easier to have these conversations outside the bedroom, perhaps over a cup of tea, when there's no pressure. And here's something important. Accept that not every encounter will be earth-shattering, and that's perfectly fine. Sometimes intimacy is about comfort and connection, rather than fireworks. Sometimes it's slow and gentle. Sometimes it's more playful and energetic. There's no template you need to follow. I've also noticed that successful couples maintain a sense of humor about the whole thing. Bodies make odd noises. Things don't always work perfectly. Sometimes you get a cramp at an inopportune moment. If you can laugh together about these things rather than feeling embarrassed, it takes so much pressure off. One more thing I want to emphasize: consistency matters more than intensity. Regular affection, regular intimacy, even if it's not always full intercourse, keeps you connected. It maintains the habit of touching and being touched. It reminds you both that you're not just housemates or caregivers for each other, but lovers and partners. According to research I've read from various medical journals, couples who maintain physical intimacy into their later years have better overall health outcomes. They live longer, they have fewer mental health issues, they recover better from illness. It's not just about pleasure, though that's certainly important. It's about the profound psychological and physical benefits of feeling desired and connected. So, what's my advice to you? Start tonight. Not necessarily with grand gestures, but with small ones. Hold her hand. Tell her something specific you appreciate about her. Give her a proper hug that lasts more than 2 seconds. Kiss her like you mean it, not just a peck on the cheek. Then, when the moment feels right, talk to her. Tell her you want to make sure she's happy, that you want to know what she needs. Be vulnerable enough to admit you're not sure you're getting it right. Most women respond incredibly well to this kind of honesty. It shows you care, and it opens the door to better communication. And remember, this is a journey, not a destination. Your intimate life will continue to evolve as you both age. What works now might need adjustment in a few years. Stay curious, stay communicative, and stay committed to each other's happiness. I've been privileged over these 25 years to see countless couples rediscover intimacy in their later years. I've seen men in their 80s learn new things about their wives of 60 years. I've seen couples who'd given up on physical intimacy find their way back to each other. It's never too late, and you're never too old. The secret isn't some magical technique or special knowledge. It's simply this: pay attention, be patient, communicate openly, and approach your partner with genuine care and desire. Do these things consistently, and I promise you, you'll both be happier for it. Thank you for listening, and I wish you all the very best in your relationships. Remember, love and intimacy have no age limit. You simply need to nurture them, just as you'd nurture anything precious in your life.